Hello everyone, this is Dr. Cui. So in this video, I'd like to discuss uh, USC, United States clinical experience. So first of all, I want to let you know that for this video, I mainly focus on the internal medicine uh, for the applicant who apply for the internal medicine to get some USCE. So if you are applying for other specialties, so you can also consider listening to my video and to get some clue how to get a USCE and what specific things you need to be careful. And now let's get started. So of course, for the USC, the more the better, but typically 4 to 6 months should be enough. Based on my own experience, only a couple of programs are required as the applicant has USC longer than 6 months. So most of the programs just need 4 to 6 months USC, and that should be enough. And of course, the hands-on clinical rotation is the best. So all of the programs would treat the hands-on clinical rotation as a USCE. Well, some program would treat the observation or the schedule as a non-USCE. So they don't think it's a kind of a USCE. So while still some program would think that the observation or schedule is a USCE. And for the tele rotation, only small number of programs would treat it as a USCE. So basically, the hands-on is the best. And also, it's better to mix your USCE with outpatient and inpatient to make it more comprehensive. And and for each department, it's better to stay there for at least 1 month, because when you when your supervisor draft a letter of recommendation and the program director read it and find out that you just stay there for like 1 to 2 weeks, and they will treat it as a weak ROR, because normally 1 to 2 weeks for the 1 to 2 weeks rotation, it's impossible for you to know the people there, know the patient or the disease and how to treat the diseases. It's impossible to know all of this by staying there within just 1 to 2 weeks. So that's why I strongly suggest you to stay in each department at least for 1 month in order to get a strong LOR. And it's also better to rotate in 4 to 5 departments. So in case that you suspect one of your author, the LOR author, give you a bad comment on your LOR. So it happens actually. You should know that sometimes you can feel that the your supervisor or the author of your LOR would give you a won't give you a good comment during drafting the LOR. So in that case, you probably won't use. You definitely don't want to use that LOR, and so here you can use your backup LOR to upload it in the ERAS. And and also the university programs are definitely better than the community or small clinics, because the title of the LOR is really important. And of course, the PD definitely want to see that if you completed your rotation in a big hospital with a strong clinical training. And also for the author, he or she should at least be attending. So the resident or fellow cannot write you a LR, and the PD won't treat it as LR, or at least a strong LR. And now I'm going to talk about how to get the USCE. Here are my strategies based on each applicant's condition. So if you are undergraduate applicants, you can apply for sub-I or other related to rotation, like the electives. Um, so those rotations only offered to the undergraduate applicants, and most of those most of those opportunities are offered by the university programs. And if it's not available due to some reasons like a COVID pandemic, please you can check other opportunities below. And for the graduate applicants, if you have connections, try your best to contact them in order to get rotation. And actually, those people not only can give you a strong ROR, but also they probably can help you to pass your package to the program director directly, so in order to give you a courtesy interview invitation. So, so if you know those people, just try your best to contact them to see if they can help you. And for the applicants still in the medical school or working in the hospital in your home country, you can definitely check if your institution have a collaboration with some U.S. Institution. Um, because I know there are a lot of med school, the international med school, uh, have some collaboration with the U.S. med school. So each year they will send their own student to the U.S. med school to complete their clinical training, and most of those programs in the U.S. will treat those students as AMG. So you will be very competitive if you complete your clinical training in the U.S. And if you don't have those opportunities, you can still try to see if your institution can reimburse your commercial rotation. So, for example, if you are attending in a hospital, and each year actually the department will offer you some opportunity to go some U.S. hospital to go some hospital in other countries like in the U.S. or uh, in the Europe to for the clinical study. So sometimes they can reimburse your living expenses and the rotation fees. So you can definitely try that too. And for the applicant that has no resources of any above, if you are still in the US, you can call any hospital clinic around your home, because you can tell them you stay in this city and you're looking for a opportunity to do the rotation in order to apply for a residency program, and hopefully they will give you an opportunity to do the rotation. And if you still have no chance or not in the US, you can Google or have a look or you can Google or look for the commercial USCE, but it's typically very expensive. It's, so the price range normally is 800 or 10,000 per month, depends on which institution. For example, if you are doing the clinical rotation in a small clinic, and normally so so sometimes normally it's only $800 per month sometimes. Well, if you are doing the rotation in a top program like the MGH or MD Anderson, so they will probably charge you higher price like 2,000 a week, or almost $10,000 a month. I would say that. So it really depends on which program you are going to rotate. And so my suggestion is you can consider by 2 to 4 weeks rotation first, and try your best to find another rotation during this time. So try your best to know those people and build connections, and know those doctors, so you can directly contact those doctors who can offer you the rotation. And so in that case, you can just avoid the agent, and then you can have a lower price for the rotation or even free. Because some if a doctor knows you and you completed, for example, you completed 1 month hands-on clinical rotation in their clinics, and they think you are good assistant. So probably they will just give you a free clinic rotation in the following months. And so here's the thing. So if you pay the agent for the rotation fee, the agent also need to give the doctor some money to cover the rotation, to cover their working hours. And so in that case, you need to pay both doctors and agent. So that's why the price is very expensive. So if you know some doctors, know some local doctors, and you just contact the doctors directly, so you avoid the agent, then you can just pay a lower amount of money for the rotation. or even get a free rotation, as I mentioned. And if you are a U.S. Green card holder or a citizen, and you can find a clinical related work like a medical assistant, coordinator, or medical scribe. You can Google for those opportunities, or you can use an application which is called Indeed to find those opportunities. And you just need to upload your personal CV, and then they will match you to the and you tell and you tell them that what kind of position you are looking for, and they will match you to those positions if it's available. And for the for so during the rotation, you definitely need a place to live. So my suggestion is that you can contact your friends to see if you can make a group, and then you guys can rent a big apartment and share the rentals with a lower price for each people. If you if you cannot create make a group, you can consider using the application which is called a spare room or Airbnb to find a place to live. And definitely you can contact the agent who can offer you the place to live, but normally it's expensive, although it's safe and close to the hospital. And for the living expenses, I would suggest you to use Amazon or other application to buy the food, because it can save you a lot of time. And if you wish, you can still go to the local store. But I personally prefer using those application because it helps me to actually save me a lot of time, and they can send those food directly to my apartment. So in order to give me more time to prepare for the exams or to study. So before before doing the clinical rotation, I would suggest you to master at least these basic skills. Um, One of it is you should check some videos, or you can watch the YouTubes to see how to collect how to talk to the patient, how to collect the patient history. So actually, it's a very basic, and also you should know how to do the physical examination in each department. Um, in other words, in each subspecialty actually. So before doing the rotation in the department, and you just watch the video, learn how to do those things, and also you need to know how to present a case to attending in front of a patient. It's better to practice at home in front of the mirror, and you should know how to do that. And also, it's better to get familiar with their EMR system, especially in the first week during the rotation. So if you can master it as soon as possible, this will be very helpful for your rotation. And also for the basic clinic skills, I would suggest you uh, to 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 learn how to draw blood for the patient and how to do the EKG. Because sometimes the nurse in those small clinics or the outpatient are very busy, and probably you need to. It's better for you to do this work by yourself to save the time, and also you can impress your supervisor. You can do those. You can do those things. So it's also very helpful for your clinical rotation in the United States, especially in the New York City in the east part, who allow the visiting students to do this job. So so my last suggestion is during the clinical rotation, just be positive. Don't be afraid of making mistakes, and cause the reason you do the rotation, uh, you just is that you need to find out your weakness and try to overcome it. So just try your best to improve yourself during this during this rotation, and be friendly to everyone. You never know if you have a chance to know someone who can offer you another opportunity for another clinical rotation or do the research. For example, when I was doing the rotation, my one of my colleague is an old gentleman. Um, Initially, I don't know where he's from and what his job. And after talking to each other, I know he's from the MD Anderson and from a very famous lab. So as I mentioned, just be friendly to everyone. So you never know if they can give you opportunity to do some for other jobs or for other rotations. And don't think you are smarter than others. And just be humble. Even you are an experienced doctor in your home country, so you need to know how you need to learn how to work with with the younger colleagues in the future, and also actually it's also helpful for during your interview because the interviewer probably will ask you this question: how in the future how can you work with your younger colleagues? So actually uh, you can just use this experience and talk to your interviewer that you had experience how to work with them and you know how to get along with them and and the, this is one of the very important experience for your future work. So that's it. So I hope this video will be helpful for you to get some USCE and good luck.